Hello again. Now it's been several weeks since I did one of these things. In April Fool's Day in fact, after over 2 years of avoiding it, COVID finally caught up with me. And I was surprisingly unwell despite all the vaccinations. In particular, sinus symptoms, lasting over 2 months. Producing, as I would call it, and as I mentioned to Howard Kane the other day in an email, a second class was told to Nottingham type nasal tone. Yuck. Lots of sinus rinses and all that stuff, lots of fresh air. Slowly it has recovered. Anyway, masks in, out, off. What's it all about? Well, we're in the front line. We're puzzled, I have to say. I never took mine off, in camaraderie with most of my colleagues. No, we didn't. We knew what was coming. What was TT supposed to result in? Within days, Meds was flagging up COVID after COVID cases. Some in the quite elderly who'd been jabbed, and some were quite unwell. So the change in mask advice was inevitable. Not only is the mask a barrier to, viral transmission, it brings with it its usage a subtle behavioural change as well, a pattern that is also another additional barrier to viral transmission. In tune with so many other COVID cases, I had the brain fog. That was odd. My memory was terrible. The profound fatigue. The drop in oxygen saturation, that was a bit alarming. The heart rate that was going on for days on end at about 140. That was a bit alarming. Kept me awake. The shortness of breath, yes. Not good. Going up the stairs, having to stop twice. Didn't enjoy that. A bit like flu, but nothing like flu. You could almost sense something alien was on board. And your numerous counter-attack immune system responses were trying to figure it out and then deal with it. But it took a long time. So when those patients I'm seeing at the moment talk about their experiences with COVID, long COVID and the lot, I can understand a little of what's been going on. I see the old chestnuts about simple tests to predict future ill health or even early demise were splattered in various newspapers this week. On this occasion, the 10-second standing on one leg test. In other words, you stand on one leg, other leg behind the standing leg, hands by your side and gazing forward for, 10 to 20 seconds. If you don't fall over, you've passed. If you fall over, you haven't. Those in the, there's not a huge study, I think, from Brazil. Those who didn't pass had on average a significantly higher all-cause mortality, in other words, death rate, of the following 7 years the monitoring was going on for. Lots of other examples exist in this kind of area, though, from the ability to get up from the floor without use of your hands, arms, elbows or knees, for instance, to speed of walking on the flat, to walking ability upstairs. In essence, the ability to move safely, balance calmly, avoid banana skins in everyday life is linked to our overall health. Not only then, but looking into the future too. Weird, isn't it? It does seem to be true. It's not then too surprising that those unfortunate enough to say, fall over, often quite innocently at home, but in doing so, breaking a hip, face such a challenge getting back to normal independent life. The hospital and community occupational therapists, a very unheralded workforce who do sterling work trying to solve the numerous practical questions that might arise when looking to get a patient home after this sort of mishap. Some souls confound us, though. I can recall a lovely lady, aged 100 plus, who did just that, fractured a hip. Not only didn't she, ask for a checkup, she waited a couple of days before asking for a visit because she couldn't get out of bed. Not only did she get on to hospital, have the x-ray, have an operation. Not only did she survive, but she got home. But golly, this old bird was, she was a queen mum. She sailed through it all crawled through it. Excuse the pun, as clearly not actually walking, more shuffling with a frame initially, then walking, albeit with a slight limp. But just goes to show you, humanoids, they just vary so much in their response to, everything adverse. Figuring it all out on a daily basis is, suppose, what we quacks do. And it's sure keeping us busy at the moment, though, those who are in work, as COVID struts its stuff. I'll keep you posted, but it's nice to be back. Cheerio.